Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, for the diagnosis of Schatzki's ring, that is for the treatment of Schatzki's ring. So, in the treatment of Schatzki's ring, actually it depends upon the symptoms. If the patient is asymptomatic, then and if the patient is asymptomatic and it is incidentally found, then and the Schatzki's ring is incidentally found, then it requires no treatment. If the ring is asymptomatic and thus if it is incidentally found, then the patient requires no treatment. If it is a symptomatic ring, and if it is a symptomatic ring, then it is of two things. If it is a symptomatic ring without reflex, then you can do esophageal dilatation can be done, mainly for the relief of obstruction. For the relief of obstructive symptoms, we can do esophageal dilatation is done if there is no reflex, and if there is only symptoms of dysphagia are present without reflex, then we can do esophageal dilatation. If the patient has two things, if the patient has both reflex is present and obstruction is present, then we should do an anti-reflex procedure is recommended in such cases. And one more important thing is surgical excision is actually not indicated. Why? Because if you do a surgical excision of this ring, like if you have excised this ring, then what happens? Now, if this is the Schatzki's ring and if you have excised the rings, this ring is excised, then what happens is there will be raw edges on both the sides, and sometimes these raw edges will come closer to each other and it will result in formation of the stricture. So to prevent that, it is better that we avoid the complete excision of the ring is avoided. So surgical excision is not indicated because it can cause esophageal sphincter strictures, because it can lead to esophageal stricture. So surgical excision is not indicated in Schatzki's rings.
thank you and thank you for watching.